Hi everyone, welcome to She Speaks Her Journey. Today we have Dr Gajaentri with us. She's currently based in Penang. She has a 6-year-old little boy and just delivered her angel baby girl 4 months ago. We are so glad that she's able to join us today as she shares her pregnancy journey to inspire and empower every pregnant woman out there. So, Dr Gajaentri, welcome to our channel. Tell us more about how you felt when you first found out that you were pregnant.
Yeah, thank you for giving me this opportunity to speak with my latest pregnancy journey. And yeah, I found out I was pregnant last year, 2020, in June 2020. And at that time, it was still COVID. It was mid-COVID pandemic. Both me and my husband, we took this positively. We accepted this pregnancy, and yeah, we were very excited, but we kept it low with my boy because he's still too young to understand at the beginning stages. So yeah, it went on pretty well. We attended our antenatal checkup smoothly. We got our first scan done, and finally at about 8 weeks plus, I started having this very bad, severe vomiting. I couldn't eat anything. I couldn't drink much, although I try, because this happened with my first as well. And probably much better than the first one, maybe because I'm stronger this time and I'm able to actually cope with this current situation. But yeah, it was equally bad. So I was admitted a couple of times in the hospital for drips because I just couldn't eat anything. So I was on MC for a couple of weeks, and I thought, okay, let's just take a short break because I know with this I can't go to work treating my patients. It wouldn't be appropriate. And on top of that, with this pandemic, yeah, we had the courage to still go on. I've learned when you have severe vomiting, I think it's best to avoid oily and strong smelling food, especially with spices. So the best tip I would give all mummies out there is, even before you brush your teeth and you know you're able to eat something, quickly gobble something dry, something simple, as simple as a cracker. And then later on, vomit also never mind lah, but so long as you get to eat that little bit, So you brush your teeth later also is okay. But yeah, this vomiting phase is definitely a short phase. So there's nothing to worry. It's very normal. In fact, this phase actually protects your fetus, right? The hormones levels are increasing. So indirectly, it's actually protecting your baby. And finally, at about 15 weeks, I told my husband, hey, I've stopped vomiting. Come, let's just celebrate. So we did the same with my first one as well. The minute I stopped vomiting, we celebrated. We went for a buffet. But of course, this time we can't go for a buffet because it was during the pandemic. So yeah, we had a small makan-makan at home, to celebrate the little moments. And then I thought, okay, come, let's just break the news to my son. Okay, let's just see how he actually accepts this news. So when we reached 15 weeks of pregnancy, and that's when I decided, hey, I told my husband, come, let's tell Sri Adhavan about he's going to be a big brother soon. So one fine morning, I quietly switched on my phone, and then my husband took out that little first scan that we had, and we showed him. Shadavan, you remember when you were young, we showed you your scan photos when you're in Amma's tummy? They said, yeah, I look like a peanut. Okay, then we showed him the photo and he was like, oh, that's another peanut. I said, yes, it looks like another peanut. Do you know what this is? I said, you're going to be a big brother. Then he was so excited, He just couldn't control his emotions. Then he was looking at me. Why is my tummy still small? Then I said, yeah, Tangachi is still small. You wait till she gets bigger. So as time flies, when I manage to eat, tummy gets bigger. And then he still ponders, how come baby is still not out yet? So he doesn't understand how the baby grows. So I started showing him photographs. I started bringing him books that actually shows the growth of the fetus, the baby itself. And yeah, then finally he sort of like, okay, this is how baby grows in mommy's tummy. So every day he'll be feeding me lah, hoping that the baby gets bigger, because he wants to see it by himself, like as in the tummy has to get bigger. So each time I go for scan, this poor little fellow cannot follow me because of the MCO, and he's still very curious. He's still very, how come? Are you sure, Amma, there's baby inside? And that time I can't feel her kick yet because it was still early stages. So every time we go for our antenatal follow-up, it's just me and my husband getting to see the baby. So he couldn't see the progress. So one fine day at about 27, 28 weeks, suddenly baby started moving. So I placed his hands on me. He said, you see, can you feel something? He was so astonished, like, baby's moving inside. So because with my first, I had epidural, and I did not feel the urge to push, to be honest. So we ended up in a vacuum. But thankfully, it was still a normal delivery. So yeah, he came out fine. So this time, both me and my husband attended course. It was about hypnobirthing. I found out about hypnobirthing through a friend of mine. And she told me, hey, give it a try. It actually guides you to relax in a hypno state where you actually sort of enjoy that moment when she's actually coming out. So it's not traumatizing for both the partner and especially for me and also the baby. So I thought, okay, come, let's give it a try. So we attended about 5 courses, and it was all online by this hypnobirthing educator. She taught us how to sort of go with the flow. And of course, being in a medical line, I know when it's time to go to the hospital. So I sort of took a balance of both lah. Don't take courage, although knowing that it can cause harm to the baby, you see. So every time when we have this course, my son would come and peek. Actually, I allowed him to actually watch those mummies birthing, and they were such in a very calm state, and the baby come out quite fine. So it was not so traumatizing for him. Then he knew, oh, this is how actually baby comes out, So yeah, then as time fly, I was really enjoying my pregnancy this time, despite not having to go out, but I still managed to also go for exercise in my little condo here, go around every day without fail. I make sure I do squats. I sit on the gym ball. I do a lot of pelvic exercise, aiming to have a normal, natural birth. Exercise played a very important role in my birthing as well. Not just hypnobirthing, but exercise. So finally
when you decided, when both you and your husband decided that you didn't want to take epidural for this pregnancy, were you fearful that how you want to overcome or how you want to get through this contraction and birthing pain that is unbearable and painful according to most of the women? So how did you take that?
Actually, I was very curious about the pain. How bad can it be? But this course taught me how to dive the pain. So they taught me techniques. Most importantly is breathing techniques, which you do not only practice when that time you have contractions, but prior to that, especially before you sleep, you always have this sort of like imaginary thing, okay, baby's going to come out fine, baby's going to come out healthy, baby's going to come out happy, and that pain, there's no pain. Okay, this every day there are millions of women out there giving birth naturally, so the pain is nothing. So every day you got to practice this with some light music behind, and of course you got some props during during birthing to help baby come out at ease, not in a traumatic manner. So we have the gym ball, and then you play some light music, you know.
Okay.
Yeah.
So it was a short, successful vaginal delivery with less pain, comfortable, relaxed environment.
Correct. For my firstborn, it was 16 hours of labor. So I was basically in the hospital for 2 days. For my second one, within 5 hours, considered long in for a hypnobirthing baby lah.
Okay.
But for me, 5 hours was quite a quick one because when I went to the hospital, I was already 4 centimeter. So I've decided to stay put, although my gynecologist said you're good to go home. So I knew she was coming out that day. So I decided, okay, let's just stay put in the hospital.
Yeah, I also feel like it's very important for women to follow their gut feelings or feeling instinct, and to if they feel that they are unwell or they feel that the baby is going to come out, it's better to be at a safer place as compared to be at home. Yeah. So when it was a vaginal delivery and it was such a relaxed environment, you were definitely given an opportunity to hold your baby and have skin to skin. How was that experience this time?
Came out differently. She came out differently compared to the first one. So the minute she came out was of course tears of joy. My husband was also like, it's a girl, because you never know when you scan, it looks like a girl, but it may come out different genders. He was very excited. So we had a complete 1 hour skin to skin before we were transferred into our another room. And yeah, it was different this time.
Yeah, that's a great life experience that you have shared. Do you have any advice or tips for all the future mummies out there as how they're going to face their fears, especially when it comes to contraction pain and so labor birth? So, in the labor pain, how would you advise them to go about this kind of fear?
I think this fear about childbirth has already been instilled in probably all of us, even when we were younger before marriage, by looking at movies, especially Tamil movies. So I think maybe my advice to all women out there is that I think all of us are very capable of handling our pain. That's why God gave us this strength. So if you want to try another alternative, I would suggest maybe try hypnobirthing. It actually helps you in a different state, not just trying to fight the pain, but it gives you confidence to give birth to your child.
That was really beautiful and wonderful journey. Thank you for sharing with us, Dr. Gajaentri. Women's birth experience can empower or scar them for life. We hope that through this, it will give strength to many and more women will start sharing their experience. Thank you so much. I'm Dr. Catherine, your OBGYN.